Some families are frustrated as their loved ones battling COVID-19 get turned away from monoclonal antibody treatments. News 4's Joylyn Bukovac spoke to a family in Colombia as COVID moves through their household, hitting one family member really hard.
He's never been this sick in his life. He's never been this sick. It's scary, especially going through the last week with my husband. It's incredibly scary.
Diane Laspada says last Monday her husband felt sick and tested positive for COVID-19.
Wednesday morning, I started calling around as far as to get the infusion done.
Laspada says since he is not considered to be high risk, he does not qualify for the monoclonal antibody treatment, even though his symptoms have worsened.
He spiked a fever of 105.1. His oxygen was down, so we just kept an eye on it.
He ended up in the emergency room, was sent home with an inhaler and cough medicine. Now he is not able to eat or drink.
He said he felt like he chewed glass and swallowed it.
Laspada has been trying to find a doctor to refer him to a COVID infusion clinic. Since they moved to Tennessee just a few months ago, the Laspada family has not had much luck. As COVID cases spike, some doctors are too inundated to take on new patients right away.
And I can't even get in until end of February.
For months, doctors have been able to use 3 types of antibody treatments to prevent COVID patients from getting seriously ill.
It saved her life for sure.
Brittany Sandridge's grandmother being one of them.
It was about 3 days after she tested positive that we were able to get her in to get the antibodies done. And then after 2 days, she started feeling 10 times better. She's still a little weak now, but overall, she is back to her normal self.
Now doctors are having to save COVID infusions for those who need it most, since only one antibody treatment is working against the Omicron variant.
There's no clinical testing that differentiates the Omicron from the other different variants, and that's frustrating for patients and for us as providers as well, particularly since some of these other antibody preparations will work against the Delta variant.
Dr. Block says Vanderbilt's COVID infusion clinic is treating everyone as if they have Omicron.
That's what we've been told by our lab and by the county health department, is just assume everybody has Omicron because it's over 90% of circulating strains in our community at this point.
Joylyn Bukovac, News 4 Nashville.